So this exercise is called the barbell deadlift. Now, you can do this from an elevated position like I'm gonna do due to some individual constraints, or obviously you can pull it from the floor as well, okay? So the thing I wanna talk about here is actually foot stance and tension, all right? So the big thing here is after you perform your hip assessment and Craig's test, you have an idea what foot position might be more comfortable for the patient. And so play with it. All right, so if you find that the patient has retroverted hips, and when you do your hip assessment, they have a lot of external rotation and they're getting more depth with external rotation, they might like a wider stance, like a sumo stance, or I call it a pseudo sumo stance. The patient has maybe a slightly more anteverted hips, okay, or they have maybe slightly retroverted hips, but they have a lot of hip flexion. They still might like a conventional stance, okay? Nobody says that you can't do all of them. Right? It just really depends on the comfort. Can the patient get in a good position to actually create tension and actually produce force where we need to? Okay, so the purpose of this exercise is to build bilateral lower extremity strength in the sagittal plane. Tissue of focus here honestly really depends on foot stance, torso length, lower extremity length, because it may bounce between being more hip dominant, so glute max would be a focus here, or it may be a little bit more quad dominant, depending on the torso position for the individual. So honestly, it depends on how the patient sets up on the exercise, which tissue is going to be a little bit more dominant in the actual exercise. Biomechanical markers that I'm going to be looking for to potentially change lumbar flexion, especially if it's painful, okay? Hyperextension in the lumbar spine, so we fall into that tonic muscle dominance here, or we lock early into that hyperextension. Maybe a little bit of cervical protraction here. Losing the lat post is going to be one as well. Yeah, so we'll just build off of that. Our sets and reps here, this is a full body exercise because our grip strength is actually a determining factor of how much we can actually pull from a deadlift position. So it's a full body exercise. So we're going to follow a rule of 10. That means 10 total repetitions, total volume, okay? So we'll have sets with small amounts of reps. Okay, and our indication for this is you think you actually need to build some strength in the lower extremity, which maybe we're rehabbing from some type of back thing, and we started to do more one glute exercise because maybe one glute had to be we had to build strength there, and now we want to transition to more grinding lift. Maybe my indication is the patient hurt their back deadlifting, and we want to transition back to deadlifting. Okay, so going over the stances real quick. Conventional stance is going to be kind of close together, okay, so about hip width-ish, right? And from here, I like starting with double overhand because it teaches a lat post better. You can work alternating grip there, but I like teaching it with double overhand to start with. I'm here, and then break the bar. So this is my conventional stance here. I can go pseudo sumo, where I go a little bit wider, and then I have external rotation here, but the tibias are vertical, okay? And my hands are inside now, and I can create tension there. This is gonna be a little bit more quad dominant as opposed to this for me is more hip dominant. I'll show you from the side here. And then I can go sumo, actual sumo. I can go really wide. The risers here actually block how wide I can go. This is definitely gonna be more, it's automatically go to alternating. This definitely is gonna be more quad dominant. When I create the tension, the torso is upright, I'm using more thigh to push the floor away, okay? Looking from the side here, I really want to create that isometric, not the isometric, but a good lifter's wedge with the upper back in relation to the torso and hips. So conventional stance, I'm here, grab it, break the bar here, and you can see how my hips are displaced more posterior to the weight here. And I pull the weight down, not letting the bar drift away from me. That's another biomechanical marker that I'm looking for. Losing that lat post as well. If I can go pseudo sumo, where I go a little bit wider, more external rotation here, but the tibias are vertical. And when I create tension, you can see how my hips are actually closer to the barbell now. So it turns into a little bit more quad dominant. So if I'm going to lift from there, I can sneak underneath the bar, and then I can go sumo, get pretty wide here. The tibias are now angled laterally. They're not vertical, they're lateral now. And I can really get wedge underneath the bar there. Okay, biggest thing here is creating tension. I want to absolutely destroy the bar. I'm creating so much tension that rogue calls complaining that you're hurting their equipment. But in all seriously though, teaching the patient actually how to create tension is so important, especially when we start adding bigger lifts like this. Have fun.